everyone, welcome to a new episode of In Other Words with Danielle and Zara.
So this is a podcast where we talk about a wide variety of different subjects, from human trafficking to matchmaking. So in other words, we talk about all the things.
Okay
Cool.
guys, today is an exciting one.
It is very exciting.
Not even just because of the topic, but because we are in person.
I know, for the first time in ages.
Danielle has decided to move here because she missed me so
Yeah,
much.
so I just booked a ticket and I came here, and now I am living under Zara's bed.
Yes.
So yeah,
Good job.
she's keeping me captive.
Yes. Okay, so today we're going to be doing female health, which I think we've been wanting to do for a long time.
Yes.
In fact, we wanted to get a doctor on, but then we decided we are females.
And we have health.
Yes.
I don't know if we're the healthiest people in the whole
No.
world, but it doesn't matter.
Just to preface the fact that, again, we aren't experts, but I think that there's certain things that we as women should know about our bodies.
Yeah.
And guys can listen to, because it's
Yeah.
really cool
In
for
fact-
you to know these
In
things.
fact,
It's pretty
you should
important.
listen. You should listen, even if you're a guy, because number one, you might have sisters.
Yes.
Number two, you might have female friends, and
Number
it's good to
three,
know.
you might have a wife.
You might have a wife.
Number 4, you might have daughters.
Exactly.
Number 5, you might have mothers. Number
And-
6, grandmothers.
And number 7, just because to be a decent human being in this world, I think that it's important to understand people and understand what people are going through.
I agree.
And women do make up half of the population, or even more, if I'm not mistaken.
I think women are still more.
Yeah. So it's good to know these things, and so you don't come across as a complete idiot on the internet when you ask things about periods. Please.
Okay, so we did ask people some questions,
Mm-hmm.
but I think we're just going to start off with chatting about some of the basics and things that
Yeah.
we wanted to discuss.
Yeah. So I just want to say that we are doing this whole sound thing by ourselves. So if
The
anything,
video, everything.
exactly. So
Yeah,
if
without
anything
a
is a bit
producer.
wonky, we do apologize, but
Yes.
there's nothing we can do about it, and I hope
Devin-
that you can listen.
Devin can't be blamed this time.
Yeah, shame he wasn't invited on this trip.
Oh, shame.
Okay, cool. So we can just start with things you just want to say.
Yes. Do
Okay.
you want to kick us off?
Okay, I don't really know what exactly to start with, but okay.
Yes, I'm also a bit all over the place.
So I think I want to discuss the menstrual cycle,
yes.
because this does form an important part of most females' lives, because most females have a menstrual cycle. The average cycle is about 28 days long, but it can also range from 21 days to 35 days, and that's still like a normal amount
for most people.
for most people. If it's not that, if you're struggling a lot with that, if your period is very irregular, you should probably go to a doctor,
Probably.
even a gynecologist. Sorry.
Oh, yeah,
Kidding. So what a lot of people don't know is that there are actually 4 phases, or like kind of
Stages.
4 stages
Yeah.
in your menstrual cycle. It's not just bleeding and not bleeding.
Yes.
And these 4 phases determine a lot of things about you, like your energy levels, your moods, all those kinds of things.
Yeah.
So the first phase that I want to chat about is the menses phase, and this is your period. So this is when the lining of the uterus is shed out through the vagina when pregnancy has not occurred. And I just want to say that we are going to try to use correct terms here. We're not going to
Yes.
say silly
No.
terms. If you're
Like,
uncomfortable, then stop being uncomfortable.
Mr. Lehman's sheet music, where he refers to his penis as Mr. Happy.
Oh, no, terrible. We're not going to do that.
No.
Anyway, so most women usually bleed for about 3 to 5 days, but it can also range from 2 to 7 days.
Yes.
Yeah, and I think if I'm not correct, if I am correct,
Yes.
I think most women tend to lose about 40 milliliters of blood throughout
Their period.
the period. Then the second phase is the follicular phase. So this is when the estrogen levels rise, which causes the uterine lining, or the endometrium, to grow and thicken. It also can cause your hair follicles to grow, so you might experience more hair growth at this time.
Yeah.
And then what happens is the developing follicle in your body becomes a fully mature egg, which is also called the ovum. And then after this, we have ovulation. So this is a sudden increase in... Yes, this is a sudden... Sorry. This is the sudden increase in the... I don't know how to pronounce this word, but the luteinizing or something like that hormone, which causes the ovary to release the egg. And this is typically like day 14 in your cycle, if we're counting the period as day 1. But obviously you can count the period as the last few days. And then lastly, oh, the light just flickered. Lastly, we have the luteal phase. And this is the phase that comes just before the period. And this is typically like day 15 to day 28. So ovulation is obviously quite a short little stage. So basically the egg travels from the ovary through the fallopian tubes to the uterus. What happens here is progesterone rises to prepare, progesterone is a hormone. Progesterone rises to prepare the uterine lining for pregnancy, and if pregnancy doesn't occur, then estrogen and progesterone levels drop and the lining is shed, and then you're back to your period. So it's all very exciting.
What's interesting though, and we were chatting about it, just like fun fact, is how like short the period of ovulation and then like that actually happens.
So
bizarre.
So when a lot of people have this misconception that you can fall pregnant at any time, and like you always need to be really careful. I thought like you have sex and you fall pregnant immediately. Like that's obviously what happens.
That's what they taught us to keep us abstinent.
Exactly. But your fertile window is basically the day that your egg is released from your ovary and 5 days before that. So you're basically fertile for 6 days. And you have the strongest chance of becoming pregnant if you're having sex
on the day that the egg
in
is
those
released.
like fertile windows. Because sperm can live in the uterus.
Which is bizarre.
Is it the uterus?
Me.
Yeah.
Yes.
Okay.
So you have sex and then you can conceive like 4 days after because the sperm is still chilling.
Yeah.
Oh man.
Always in places we don't want them to be. Just kidding. We don't hate men.
No, we don't. So I just thought that was very
and there's so 12 to 24 hours after ovulation you can't really fall pregnant anymore, which is quite interesting.
Yes, because that's why it's crazy to me that like 6 days out of your whole like 27-day cycle, whatever, is when you fall pregnant, and so many people fall pregnant like unintentionally.
Yeah.
And then some people who are trying to fall pregnant are so intentional about being in that window and they can't. So it's quite interesting.
There's so many factors that go into it.
Yeah. Okay, what else did you want to add? Because I've like vaginal health tips that I want to get into.
Okay, you can get into that because I'll remember things as we go on. I've written a lot of stuff down, but it's all over the place.
Okay, cool. So I kind of just want to speak a little bit about cleaning your vagina.
Okay.
Because...
and by vagina, do you mean the actual vagina or the vulva?
Yes. So like your actual vagina, like what's interesting is that I used to, only until I was an adult did I realize that the vagina is it's self-cleaning. Yeah. Like I just always used soap.
Like up there?
No, not all the way up there, but like...
Do you mean like just the outside vulva area?
Yes.
Okay.
And it actually doesn't need...
It doesn't.
...to be cleaned. Like I never used I used sensitive soaps and stuff, but you actually don't need to.
You don't.
Like even just water and you're good to go.
Exactly.
And it's actually not very good to be cleaning.
It's not. It can cause like a lot of problems.
Exactly.
It can give you yeast infections and all those fun things.
Yes. So that was just like very interesting to me. And something that I only later realized was just how important it is that you kind of let your vagina do what it needs to do.
Yeah.
So even like discharge, like that was something that didn't worry me, but I didn't enjoy it per se. And there would be days where I'd wear like a panty liner, but that's actually not good because
it's not great for you.
Those things are normal. The vagina is doing what it needs to do in order to stay clean, etc. And what's important is that you keep the area from becoming moist. So when you have a panty liner on, like you kind of not infecting that area, but you're allowing for bacteria to build up because bacteria thrives in moist environments. So like when you get out the shower, it's important that you dry there properly. And underwear, like choosing underwear is important because like lace and all of these things are so pretty.
Yeah, they're nice, but you shouldn't wear them all the time.
They're not breathable at all. So again, you're creating a very moist environment for bacteria to thrive.
Literally.
And like, it doesn't have to be like this, gross thing. I mean, it is, you don't want to get infections, but some people are just naturally
very prone to it.
More prone to infections. So like cotton is a breathable material.
Yeah.
And in fact, a lot of people, and I thought this was not weird but uncomfortable for a long time. Now I'm very chilled with it, but sleeping without underwear can actually be very good because your vagina can breathe.
Exactly.
So yeah, just some like hygiene tips that I thought was important.
So I feel like, I don't know, I want to be careful, like, because when we refer to the vagina, like, we need to remember that the vagina is like the actual,
not the pee-pee.
Yes, but the vagina is like the inner.
Okay, yeah,
it's the inner tube.
Not
so
the
like
vulva.
Yeah, so so I feel like sometimes like, and like we'll do it now as well, just because it's easier.
Yes.
But usually when we refer to the vagina, we refer to the whole area.
Yes.
And that's not really the vagina. It's the I think it's the vulva.
The vulva and your urethra.
Yes, which is formed part of the vulva as well. It's all very interesting.
Oh wow.
Yeah. So. Yeah, and you also need to be careful. Like, you actually shouldn't wash inside your vagina. No. You should not do that at all. No. And some people are way more sensitive to like certain soaps than other people. Like, I'm not really that sensitive to things like that.
Me neither, thank goodness.
And also, guys, if you're buying like feminine washes or feminine sprays to make you smell so pretty, it's not supposed to smell like that, and it should not smell like that.
In fact, like doctors will prescribe what do you call those where it's like to clean out like douche and stuff like that. And I've actually like newer research says that those things they're
not great.
Not great, which is still, it's quite interesting how even doctors are still like debating these kinds of things.
I think that just comes down to like a whole problem within the medical system where it seems like still a lot of problems relating to female health and even just normal diseases in women, like they're just not that studied.
Yeah, and something I want to go into later is just like how much women seem to need to advocate for their health and things that are like pertaining to women.
Exactly.
But we'll get into that.
Yeah.
And then also like I've done some reading about how like the food you eat like affects your
it does
your like vaginal health, if you will.
Yes.
But I will say that's not something I've focused too much on.
No, I feel like not everyone needs to focus
a lot of people
so
are very
that.
stressed about like the smell, especially during your period, but like
it is what it is.
Yeah, and your blood smells like blood, and if you have like some hectic odor, don't just like try and mask the scent. Chances are actually there's probably something up because it's not normal for us to.
Yeah, and if you're trying to make yourself smell nice, like with sprays or whatever, you're probably making it worse. Yeah. So that's just something to keep in mind. And like, if you're someone who's sexually active and your partner is complaining about the smell, they need to grow up, to be honest. They need to grow up. And obviously, if it's a terrible smell,
then
like,
you should go and see a doctor.
But if it's just a normal smell, like, Anyway, that's that.
Yes. Something else that I just thought was maybe interesting to chat about is, just before we move on from like hygiene, is pubic hair. Mm-hmm. Because there is this sense of like, if you have so much pubic hair, it's very bad. But it's very normal.
Very normal.
And I think to feel comfortable, you just need to groom well. You know? And don't feel like stressed, like this hair is ugly, number one, or it's like bad because it's unclean. Like you clean anything else.
Exactly.
And don't go hectic with a razor, because the ingrowns and stuff is not going to be a fun time. No. Especially like the
it's
itching.
Not a good time. Oh my gosh.
It's a no. It's very scary.
Yeah.
Okay.
Yeah, I can't think of anything else that I have to say right now.
Okay. Yes, I think we'll go to advocating for your health later on when we talk about like PCOS and stuff like that.
Yeah.
PCOS. Then I call it PCOS.
I love that.
People say like PCOS.
Yeah.
But I know someone who has it and they call it PCOS, which is why I refer to it.
I love that. It's like a peacock.
Rough. So should we maybe chat about just when to go to the gynae and pap smears?
Yes. Okay. I don't really know much about this.
No.
I assume that you've done research, because I forgot to research that.
So I am 23 and I haven't been to the gynae.
I haven't been yet either.
And I am probably a very good candidate to go to the gynae. And if you want to know about that, go listen to our episode on Virgins Who Talk About Sex. Because I spoke a little bit about how I struggled with my cycle. So I should probably go to the gynae, but I've kind of struggled between do I put it's not even reproductive health, because I'm not reproducing per se, but like that female health, if you will, versus my mental health, and they've kind of been fighting against each other.
Yeah, it's a tough situation to be in.
Yeah, so I kind of made the decision that I will probably go and see a gynae if something becomes so hectic, my period becomes so hectic, or something really goes wrong.
Yeah.
Then go visit a gynae. I think if I was on medical aid that just paid for everything and I didn't have to think about it, I'd probably just go to the gynae to chat and have fun.
That'd be amazing.
But I think until I'm like planning on being sexually active, it hasn't been on the top of my priority list. And I know quite a few people where that's been the case.
Yes.
But what's interesting is a lot of people go to the gynae just for information. So like if you are very young and you go to the gynae, like let's just say you've just got your period, or you're growing up or whatever, a lot of them don't even do an exam if you're too young, like an internal exam. They just sit there and you chat about it, you give them your history.
That's great, yeah.
And the thing is, for me, I think you can do that with a GP if you're comfortable with a GP. So I think if I will personally just advocate for chat to your GP first. However, there are certain things that a GP is just never going to be able to tell you.
Yeah.
And then they say that you should go and see a gynae from the age, like from when you turn 21 to 25. Like that's when you should start going to the gynae.
Yeah.
And you should go every 3 to 5 years.
Okay.
Yes. And a pap smear. So when I was younger, I've always known, like I've always heard the term.
You heard the term all the time.
And I always thought it was like they have to smear something.
Yes.
That's not how it works.
No.
So a pap smear is literally a screening, particularly for cancer, which sounds really scary.
Yeah.
But it's basically,
so important.
Yes. Because like cervical cancer, and we'll speak about HPV and that later.
Yeah.
But it's the most common cancer among women, but it's the most preventable.
Yeah.
So what they do when you go for a pap smear, and again, I haven't been for one, but it's nice to know what to expect.
Yeah.
Is so your gynae will kind of just feel up there, which is so uncomfortable to think about. But I mean,
they're professionals.
Yes, and make sure you're with a gynae you feel comfortable with, please.
Absolutely. I can't imagine not being comfortable.
No. And then what they do is they use basically a spatula to open the area up, which sounds terrifying, but at the same time, that's where like babies are coming out. So don't worry, it's stretchy. You'll be fine.
It is stretchy.
And then they take like a spatula and feel up there, but the point is to collect like cells.
Yeah.
And then that gets sent to a lab, and
then they check to see what's up.
They check, yes.
Yeah.
And what's interesting is that with cervical cancer, you can see where there's a risk for cervical cancer before you've even had cancer. So they can determine beforehand, and if so, then you can take necessary precautions so that you don't even get cancer.
Yeah.
And because it's so common, it's important that it's checked.
That's amazing.
But a pap smear is literally just an internal exam to make sure that everything is okay.
Cool.
So,
that's really good to know.
Yes.
Yeah.
So they're not like smearing butter. In my brain, I was like, when I was little, I remember thinking like people would like, I'd hear in conversations like women speaking about going for a pap smear, and I was like, I feel like that sounds like they're going to butter your vagina.
Sounds awful.
But that isn't what happens. Okay. Are you ready to move on to the questions?
I am so ready to move on to the questions.
We are always asking our listeners questions, so follow us on Instagram at @inotherwords_podcast.
Indeed.
We post links to SurveyMonkey.
And it's anonymous.
It's anonymous, yes. Some people still don't know that. I was asked the other day.
Really?
Is it anonymous?
We always say it's anonymous.
If you use SurveyMonkey, I promise there's no way we can see.
We literally can't see. Like we can't.
And I don't care enough to look.
No.
It's fine.
Like you literally can't even.
No.
Okay. So we can start with the first submission.
Yes.
And this is multiple questions in one. So we're just going to go one question at a time.
Yes.
And I'm excited because there's a lot to say.
Even me.
The first one, it's not even a fully formed question, but sneezing on period?
Question mark.
Terrible.
You
Not a
read
good
it
time.
perfectly. I don't really know what the question is, but I'm assuming it's like what happens.
Yeah.
It's the same as like, you know, if you laugh and then like you wee.
Yeah.
I mean, hopefully you don't do that, but like when it's that same like
Yeah,
reaction
yeah.
or like
Yeah.
when you cough or whatever.
You can feel something happening.
Yes, but it's not like a waterfall.
No. And I just want to say that a lot of this, it does depend on what sort of products you are using for your period.
Yeah.
So when I used to use pads, I could feel it a lot more, but now that I use a menstrual cup, and even when I wore a tampon, I couldn't feel it that much.
Yeah.
Because things are up there keeping the blood from coming out.
Yes.
So
Yes.
yeah.
Cool. Then the next one says, does the blood crust on pubes? In other words,
It can.
Can the blood become crusty on your pubic hair?
It can.
Yeah, I can, but I don't, like personally it hasn't been super common for me.
Yeah.
Because you just need to keep it clean.
That's the thing.
And the thing is you're going to the bathroom pretty regularly,
Yeah.
whether you have your period or not. So when you're wiping down there and everything,
Yeah.
it's like, it doesn't go long enough for it to become
It's probably the worst.
dry.
The worst in the morning when you wake up. I
because
remember
you've-
that being the
yes.
worst. But now, like I said, like I use a menstrual cup even when I sleep because you can keep it in for like 12 hours.
Yeah.
So, yeah. Okay, the next one. This is a big one. Purpose of the hymen. Okay.
Yes.
So, a lot of
Do you want to know about
articles.
the history of the hymen?
Yes, please.
Okay, well, I just know that it has to do with Greek history.
Oh.
The end of it.
Is that okay?
It's something about Greek mythology.
Okay, thank you.
I was too lazy to read,
That's
but I
okay.
just felt like that was important to mention.
Yeah. So the hymen doesn't necessarily serve a specific purpose.
Yes. So the hymen is basically like a membrane
Yeah.
that like covers the vagina, but not completely.
Not
Like there's
completely.
still like a
Some
hole.
people it does cover completely, but then it makes things uncomfortable.
Yes, and some people actually don't have a hymen when
Yeah,
they're born, and
exactly.
it's very difficult to figure out.
Yeah.
Whether
So
there is even one there, how
yeah.
big or how small.
you can't even really see it or feel
it's
it.
like a weird little covering.
Yeah. So a lot of people think that it's there to protect like infants and children
Yes.
specifically from like germs and dirt from being pushed up
Yes.
the vagina.
Yes,
But-
especially that's the only
Yeah.
purpose that
Yeah.
people have come to the conclusion of, and it's in a sense it makes sense because when you're younger you're still building up an immune system.
Exactly.
But beyond those tiny years, it's pretty pointless.
And it's very natural for it to stretch out and
Yes.
eventually break, even though like some people don't even know
yes.
if theirs has
No.
broken or not. Obviously, sometimes you can tell after the first time you've had sex, but not necessarily either, because some people it just never breaks, and some people it breaks from literally doing normal activities. So if you're riding a
Yes.
bike, riding a horse, doing gymnastics,
Yes.
putting a tampon in, things like that,
Yes.
it can cause it to break,
And
so
I
to say.
think we just need to emphasize this idea, like hymen does not equal virginity.
Exactly.
Like that's absolutely absurd.
Yeah. Like they say, like an intact hymen is a myth really, because it can vary in shape, in size, thickness. Like it doesn't necessarily cover everything.
Yes.
Like,
And
you
the
know?
thing is, like, what's disgusting to me in like to think about is like people like checking someone else. Like,
Bizarre.
that's a huge invasion of human rights. But checking like someone's hymen, because even if you check yourself,
You can't feel it.
You can't tell
No.
if you still have a hymen or not. I think there's this idea that it's this very like
Distinct thing. Yeah.
In fact, like when your hymen breaks, like it's not like this big explosion and you feel it and a child is
No.
like has to spend a day in bed. Like
No, it's nothing
it's
like
really
that.
like nothing.
Yeah.
So yeah, I
Yeah.
just think
That's that.
yeah,
Okay.
cool. Then the next one is the bleeding constant or kind of like comes and goes?
Yeah. So when you're on your period, first of all, something I want to say is that you can't hold the blood in. For some reason, a lot of guys especially think that you can hold the blood in like you can hold pee in, and that is
Yes.
not the case.
No, it's very the vagina actually is quite involuntary in a
Yeah,
sense.
it's
you don't
just
have a
shedding.
lot of control.
It's shedding the lining. That's what it's doing.
Yes.
It's not constant in like volume. So
Yeah.
for me specifically, like my first day of my period is fine. Second day is really heavy.
Yeah.
Third day, like kind of like medium, and then it gets less and less.
Yes, and I think that's like that for
Most people.
That's how it works.
Yeah.
Also, some people have far heavier flow than other people.
Exactly.
It's a huge thing. Genetics is actually very, very
definitely
like has quite an impact on that.
Yeah.
But yeah, it's like I said, it's not like a weird waterfall. It's just like,
and it doesn't
half the time you don't feel it.
Exactly. It doesn't come out all at once.
No.
Yeah. It's difficult to describe. Like, I can imagine if you're a guy listening, or
like
maybe you're like a very young girl. I don't know what you're doing listening to our podcast if you are so young and a child, but
children shouldn't have cell phones.
Exactly.
Anyways,
cool.
Yeah.
Okay. Does chocolate actually help?
I haven't heard that chocolate helps with the period until this very moment.
It can, yeah. So there's some studies that have been done that find that chocolate, especially dark chocolate, I think milk chocolate and white chocolate doesn't do much, but it can help some women with cramps because it gives a dose of magnesium.
Is it not like it affects, you get like a weird dopamine?
I mean, it can do that too, but
affects the estrogen. I don't know.
It can do that too, I'm sure, but what I read, it said there's some magnesium or potassium, but I think magnesium in dark chocolate that can help with cramps.
Interesting, yeah.
Yeah, and it just makes you feel good, to be honest.
Yeah, to be honest though, like when I have period cramps, because I struggle with period cramps, is like I feel like caffeine makes it worse.
It does.
For some reason. So like if there's caffeine in my chocolate, caffeine in my coffee, like often when I'm on my period, I don't necessarily want those things.
Yeah.
So it's a weird thing.
Yeah, there are some foods or drinks that make cramps worse. So caffeine is one of them. I remember the one time, which it's actually kind of weird because now green tea has caffeine. So you think like, oh, it won't be good, but some studies show that green tea can actually help. Yes. So I don't really know.
I drink a lot of rooibos tea. I find it very soothing.
Yeah. Ginger tea I find is the most helpful. I mean, I don't always get cramps, but when I do, ginger tea is extremely helpful. Yeah. So that's good to know.
And by the way, for those of you who don't know why they're cramps, it's literally the contracting. So yes, that is that. I also just one thing I want to emphasize is when it comes to cramping, it's very normal. But if it's to the point where you
can't do anything,
that's not normal.
That's not normal.
And what's difficult, if we can talk about this now, when it comes to advocating for female health, is so I've always said I don't want to go to a male gynecologist. Like, no offense to male gynecologists.
Yeah, like, thank you for your work.
But for me, it's always easier. Not always easier, but it makes sense for me to talk to a female because they have a female body and so they know what it's like. But if you've never had like hectic period pain, if a young girl, for example, comes to you and says like, I'm struggling with my period pain, you can just be like, oh, she probably has a low pain tolerance. Like, I've had this and I was fine. And you'd be surprised how many doctors like think that.
Yeah.
And really not to like criticize doctors at all.
Yeah.
Doctors are amazing. But so in that sense, like there can be a comparison thing and it can be very, very dangerous. Whereas like I've heard of a friend, she was talking about a friend who's a male gynecologist and he has no sense of like period pain. So he's like, he has no idea what it feels like. So he feels it's important to treat every case because like he has no idea. Yeah. But for the most part, I would speak to a female. But the thing is, like, if you're having serious problems and your doctor just seems to be disregarding, like, you need to figure it out. Yeah. And also, the pill doesn't fix things. It's like, oh, your skin's bad, take a pill. Yeah. And like, I've been on multiple pills and the birth control patch, and it's like, okay, but like, I want to understand what's wrong. And a lot of people who have had like endometriosis. That's not how you say it.
Endometriosis. That is how you say it.
Sounds wrong.
Endometriosis.
Oh.
Yeah.
Okay, good job. And PCOS, it like you feel period pain, and that's kind of the first signs. And if you go on a pill, it might mask it, but
it's not necessarily going to tell you what the problem is.
So
and I
just,
think,
periods suck. And like I will easily take a day off to like deal because I have a hectic period, but it shouldn't make everything you do impossible because that's not normal. If you're like throwing up from pain,
that's not normal.
No.
Even if you're losing like ton of blood.
Yeah, that's not good.
Not normal.
Even that, like, then you need to have your iron levels checked, like,
Exactly.
and advocate for those things.
Yeah.
Like, you know.
It even makes me like so angry sometimes, you know, that women will go to the doctor or whatever and they say, no, I'm really struggling with this. And they're like, well, period cramps are normal, so just deal with it.
Yeah.
And it's like, okay, but you don't, like, we mostly know what is normal for our
Yes.
bodies, I think. Like, don't doubt your intuition. So if you feel deep down like, no, something is not right here,
Yeah.
you need to go get that checked out and advocate for yourself. Like, if, and it's like, it sucks that we have to do that, but when it comes to our health, because it is like, it's part of us, you know, like our reproductive health and all that, like, it's part of who we are.
Yeah.
It's not something you can just put to the side.
Exactly.
Okay, next question.
Yes.
Is
Is it me or Hugh? I think it's me.
Yeah.
Are white pants basically advertising that you're not on your period?
Maybe for some people. I don't own white pants.
No, I used to, but I don't really advertise whether I'm on my period or not.
No, I think this is just the idea that, you know, like we're so scared of our period leaking through our clothes, and obviously if you're wearing white pants,
But
then
I would be if I were wearing white pants and I had my period.
Yeah.
So, but like I said, I don't wear
No, and also like
white pants.
it depends on. Some people like might not want to wear white pants on the heaviest day of the period, but then the next day.
But I also,
they might
like,
want
if I'm
to.
going somewhere and I'm going to sit down on like an outside bench, I won't wear white pants either.
No, definitely not. But I mean, typically on my period, like I wear, if it's summer, I wear a dress.
Yes.
Because you don't need to sit on the material.
Yes.
Or I wear black pants or like red pants.
For me, I just wear, like, I have skinny jeans and then like jeans that have a bit more breathing space.
Yeah.
And I will not wear tight pants.
No,
when
thank
you're on
you.
your period, because that's
No.
Yes.
Okay. Thoughts on period sex. So we have said so many times.
We are just virgins who
talk
talk
about
about sex.
Just opinions, I guess.
Yes.
So largely it is safe and it can actually help to relieve cramps with pain relief and all that kind of stuff. It can make your period shorter because your muscles are busy doing the things, and it can get, you know, the blood out faster apparently. And also a lot of women have an increased sex drive when on their period. So sometimes you got to do what you got to do.
Yeah.
But ultimately the drawback is that it can be messy, which,
Yes.
you know, just getting blood on sheets and towels can be an unpleasant experience. So it's all up to your own preference.
I think there is this strange thing where it's like you shouldn't have sex on your period, but like you really can.
Yeah, you can.
I think for me, I was saying to you earlier on, and this is something I wanted to say in this episode, is periods are not dirty or bad, and they shouldn't be kept a secret. Like, when you're a young girl and you just got your period, like, don't advertise it, but it's not like boys can never know, or like you have to run to the bathroom and like hide everything.
Yeah. Like, I've done that and it sucks.
And like you whisper like, I have my period.
Or like you use innuendos.
Every single person,
Yeah.
or hope most females get their period.
Yeah.
And so it's very normal. But when I personally, like, I know my period's not dirty, it's a very natural thing, but I just feel yuck. Like, I just want to like shower and sleep.
Yeah.
So for me, I mean, I've never been in the position, but I don't know how keen I am to have sex when I'm on my period.
Yeah.
At the same time, though, like you said, it relieves cramps. There are a lot of studies now, even when women are in labor,
Yes.
that like
doing stuff
they
can actually
recommend
help.
that you do stuff so you
I know, it's so
orgasm
interesting.
and it releases fun hormones
I
that
know.
make your pain less.
It's a legit thing.
I mean, if you have really bad period pain, do what you gotta do.
Yeah.
But
But if you, like, don't feel pressurized if you don't want to do it, and like, don't force yourself.
No.
Okay.
Is it mean?
Yeah.
Do women have to change their pad every time they go to the bathroom?
Not necessarily.
No. So I was reading, and it says that it really depends on the heaviness of your flow. So like tampons and menstrual cups will last you a lot longer.
Yeah, they do.
Than pads, because of the ones on the inside and the other ones on the outside. But it really depends on when in your cycle. So I think most people change like 1 to 6 times a day.
Yeah.
Like 1 being like you should change at least once, just because it can get like messy and dirty and stuff.
Exactly.
But some people change to like 6 times a day. And what's nice is that you do have and it's the same with tampons. Like there are different
sizes. Also with menstrual cups.
Yes, and it, like if you have a heavy flow, they have pads designed for heavier flow and stuff. In the beginning of your period, sometimes like you can use panty liners because it's very, very little blood. But no, you don't change every time. And if you do, then that.
I mean, it also depends on like how often you need to go to the bathroom.
Yes.
You know?
Okay, but I go to the bathroom all the time.
Oh, me too. So I drink way too much water.
I don't.
Actually, I drink the perfect amount for me.
Yes.
Okay, the next one. What are the most common things that can knock a cycle out by a few days? Okay, so this was a tricky one for me to research because everything I found out about, what can throw off a cycle was kind of like more permanent things. So for example, things like if you have PCOS or PCOS, that can knock out your cycle. If you change birth control pills or anything, that can also change your cycle. If you're pregnant, obviously, that can knock it out by a lot of days. If you're breastfeeding, it can also change things. And then also, like, if you're very stressed, that can also knock out your cycle, same as if you're overtired or even if you are not eating correctly.
And this is like a huge thing, again, like mental health and physical health go hand in hand.
Hand in hand, absolutely.
Some other things I found is, this is important to understand with birth control, is that, so birth control is, you'd hope that you get your period on the right days and all of these things because you're literally controlling those things.
Oh, are we talking about like the
birth control pills?
Okay.
Sorry, but like a pill can take your period away completely.
It can.
Like, fun fact. And that's not a bad thing. It's not a sign of like you can't ovulate or whatever. Some periods just do that. I mean, some pills just do that.
Yeah, and pills do tend to prevent or change your ovulation a little bit.
Which is why people go on pills for like heavy flow and cramps because it kind of lessens that. And then also thyroid imbalance.
Yes.
And what's interesting is when your thyroid levels are wrong, it can also cause depression.
Oh,
so there's a cycle of like depression, thyroid, and period issues. Like,
rough.
So you can kind of figure out like each one can impact the other.
Yeah.
So have your thyroid checked if your period doesn't seem right. Also, it's actually okay if your period is all over the place.
Mostly,
like, especially like when you're young, like it takes a while, and some people they have very strange cycles, and it doesn't necessarily mean something hectic is wrong. And other people, they know the exact day they're going to get their period. And then also like when you're going into menopause and going through that, obviously
it's gonna,
because
things are gonna change.
You're losing your period altogether.
Yeah, I mean, my period, like, I'm lucky enough to have quite a stable cycle, so so I know pretty much when I'll be getting my period, which is really nice to know. But I mean, there was a stage last year where, and I'm telling you, this was because of cycle syncing. And now some people say that is a myth, but I strongly believe in it.
Really? Okay.
Cycle syncing as in like,
with people in your house.
Because I was living with my cousin last year.
See, no, I don't believe in that.
It's true though.
Guys, Danielle and I just found something that we
don't
agree on.
I promise you it's true because I've literally experienced it. So we were like 2 weeks apart. So I'd get my period 2 weeks later, she'd get her period.
Yeah.
As the year went on, we literally started on the same day. On the same day. It was bizarre.
But like, are there studies to prove that? Or is that just your personal experience?
But there's a lot of women who've experienced the same thing.
Hectic.
So it also goes back to like
the moon.
I mean, that was a thing. So like I strongly believe in it, but basically what was happening is that it took me, the one time like my cycle was about 35 days and it's usually 28 days, like, or 30 days.
Yes.
And I was like, literally, what is happening? And then eventually I was like, I actually think like we're genuinely syncing up our cycles.
Interesting.
Yeah.
But like, scientifically, that doesn't make sense to me.
I like hormones, I think, are like really strong. And even you think about like
when
you become attracted
to someone,
you're attracted to pheromones and all that kind of stuff.
Interesting.
So
yes.
I'm just saying, don't dismiss it.
Fair. I'm a skeptic, but
because also
it's very interesting.
But also because I'm someone who has a very stable
so
cycle.
I could never sync up with anyone. I can't even sync up with myself.
That sucks.
And then another two things is significant weight changes. So if you lose a lot of weight or
gain a
lot
of
weight, your period probably will change. And then also too much exercise, because when you exercise a lot, your estrogen levels are low. So that can change your cycle. Okay, and then next question. Are there any common misconceptions that are personal pet peeves? That's a lot of P's. So for those of you listening, I'm sorry if that felt hectic in your ears.
Yes.
Any pet peeves, misconceptions that personally bug us?
Okay, so I have 2 written down, even though I'm sure there's many more that bother me, but I can't think of anything else. So the first one is that we get completely emotionally irrational on our periods, or like just in general.
Yes.
And I'll tell you why. So it is, we're going to talk a little bit more about being sad and like depressed on your period.
Yeah.
But if you understand how the cycle works, you will understand why we might feel a bit sadder at certain times of the month than others. And it's very biological, very scientific. It makes complete sense.
Yeah.
It all makes complete sense. Like, it's not completely irrational out of the blue that all of a sudden, like, oh, I'm feeling so sad and I can't control myself. And listen, you do feel a bit sad on some days than other days, but it makes sense why you feel sad.
Yeah.
And you can control yourself.
Yes.
Like, we're not completely irrational human beings all of a sudden.
No.
So that's just something that really bothers me.
Yes. And in the same breath, mine is the kind of the opposite, but like I agree, is this idea that like PMS isn't a real thing.
It is a real thing. Yeah.
It really is.
And it's also to do with your luteal phase and the all of a sudden dropping of your estrogen and progesterone and all that kind of stuff.
So people, you say like, ugh, don't blame it on PMS if you're feeling emotional.
Yeah.
So
like, there is a reason. That's what I said. Like, there is a completely valid reason why you're feeling that way.
Exactly.
Because hormones are a legit thing. So, yeah.
Yes. Then another pet peeve, also just going back to sex, gotta love it, is just because, so the only method of contraception for guys is like, well, not that guys can fall pregnant.
A condom.
But is a condom. And for women, there are a lot more options. Yeah. But that doesn't mean that women are responsible.
Yes.
For contraception.
Men can impregnate a woman every single day of their lives.
A team effort. So please don't just expect the woman to sort those things out.
Exactly. Okay, and then my other one, and this is something you've already touched on, is that the period is dirty.
Yes.
And so listen here. No one wants to get blood everywhere. It's not a pleasant experience.
No.
And when we say like, oh, you shouldn't be ashamed of your period, we're not saying, oh, go spread it around the world, go tell your boss that you're on your period, because like that's just awkward. Like, I'm not going to tell everyone all the time when I'm going to go pee or whatever.
Yes.
And the thing is, there's also this idea that period blood is like highly toxic and highly dirty, and that is simply not true, because that is the uterine lining. That is what it is. That's what a baby grows in if you fall pregnant. Like, it is not super dangerous or super disgusting. Obviously, we don't want to get it on our sheets or on our clothes just because it's unpleasant to get out. But yeah, I just hate that it's like people are so disgusted by it.
Yes. And then one more thing, and maybe it's a little bit like off topic, but it's just this idea that women's bodies are sexual and sinful.
Yeah. No. We are made like this for a very good reason.
Yes, and it's like all of the things that happen are for our health and like even reproduction. It's just not all about like
having sex
and dirtiness, and
exactly.
I just don't like that.
Exactly. And I think
also women's boobs are not just for men to look at, they are to feed humans.
Amen. And I think just normalizing the conversation around periods and all that will help help the conversation get away from sex and gross things,
Cute.
Okay. So the next submission, that was all one submission, by the way.
Yes. We thank you so much.
Okay. So the next question is it my turn?
Yes.
Okay. Sorry, I just need to find my place. Do
you want me to read it?
You can read it, yeah.
Okay. So, are one of the common symptoms when you are on your period to be depressed or sadder than you usually are?
So, yes, that is a very common symptom to go through. I have spoken a bit about this, how, like, I never really used to feel super depressed or sad, and then last year, all of a sudden, like, especially before my period started, I would feel incredibly sad. I'm like, oh, I don't know what the point of life is kind of vibes, which is not super exciting to feel that way, but at the same time, it does make sense why I would feel that way. So if I just I did already explain like the stages in your menstrual cycle. So basically why you can feel really sad is when you get your period, after ovulation, your estrogen and your progesterone falls, and the rising and the falling of these hormones can affect the neurotransmitters in your brain, such as serotonin and dopamine, which are all the things that make you feel so happy.
Yes.
And when these are affected, it can lead to sadness, anxiety, irritability, sleep problems, food cravings, etc., which are all very common on your period. So when your estrogen and your progesterone rises again after the onset of your period, then these symptoms typically go away.
Yeah.
So that's why a lot of people feel really sad in the days leading up to their period and just at the beginning of their period.
Yes.
And not everyone gets PMS or premenstrual depression or menstrual depression or anything like that. People think that this is to do with genetics and stuff. But
Yeah, I think it's important to remember that the whole cycle of our periods are very heavily reliant on hormones, and our emotions are determined by hormones.
Amen. So, it makes sense.
Yes. I do want to mention though, PMDD, which is premenstrual dysphoric disorder.
Yeah.
And that is like during your period, like you can do nothing. Your anxiety and your depression is so bad, you're suicidal. And you can tell whether it's like a mental illness or if it's to do with your period because the symptoms disappear when you get your period.
But it's intense.
So that's more serious than just like PMS.
Yeah.
So then, you need to see a doctor because
please.
Yes, there's often so it can't be cured or whatever, but then there's medication that you can take, like tools you can find in place so that during that period, you can function. So
So don't feel alone if you're feeling that way. It's very normal. I think
it is
probably most
women
you're
more likely to want to cry during the period.
Yeah. For me, it's always like the day before. All of a sudden, I'm just crying, and I'm like, why is this happening? And then I realize, I'm starting my period tomorrow for sure.
Which is why apps are nice.
Very nice. I strongly recommend, both of us strongly recommend that you download an app.
Yeah.
Okay, the next one. How often do I need to shower?
Yes, so this question was asked by Stephen Locke in grade 12 at St. Charles, and I'm disappointed
Embarrassing.
in you.
Okay, so we already discussed, not because we're relating it to female health, we've already discussed that you don't need to soap and water.
Yes.
I mean, you should water, you can use soap, but you don't need to
sounds like you're watering a plant. Yes.
True. You don't need to thoroughly clean your vulva. You don't need to clean your vagina. Please don't do that.
Yeah.
But okay. So there's no definite number on how often you should shower.
No.
It depends on your activities of the day. So for me, sometimes I don't shower every single day. If I'm literally sitting doing nothing all the time and then I'm too tired and I don't want to shower, which is sad because I love to shower.
Days like that.
Oh, very few days. I love to shower.
It's not like you shower 5 days a week, 4 days a week, most weeks.
No, I mostly shower every single day, but sometimes I'll just be so tired and I'm like, I will just clean my feet and get into bed.
Yes.
Yeah.
So again, I think doctors will say okay, fine, if you don't have to clean every day, but there's no harm.
There's no harm
in showering, cleaning yourself every day. And this became a thing when a bunch of celebrities came out saying that they only bath their kids twice a week or something. But especially for kids,
I know they're rolling around in the mud.
Rolling around. There's
make them sound like they're dogs rolling around in the mud.
I mean, it's not wrong. So I feel like it's super important, and I love to shower.
Yeah.
And it's the reason why we should be showering is like bacteria and dead skin. You can't see it, but it's there.
It is there.
And if you get into your bed and then don't shower and get into your bed and don't shower and get into your bed.
Yeah, you're making yourself very dirty.
You're getting into a bed that's,
Yeah.
And for me, I personally just cannot sleep if my feet are dirty.
Yeah. That's why, if I don't shower, I'll always clean my feet at least.
And getting into bed is...
It's the best.
Is a time.
One thing, though, if you are... There is such a thing as overshowering, which is if you're showering multiple times a day, every single day. And it can irritate your skin, especially if you're using hot water. It's probably a bit different if you're using, lukewarm or cold water.
I love my hot water.
Same. But if you are taking very hot showers and using soap all the time, it can destroy your skin barrier. So that's just something to keep in.
Your natural skin oils as well. They can actually dry your skin out more.
Exactly. Yeah. So that's something to keep in mind because your body does have ways of keeping you clean and healthy.
Yes.
Obviously, if you are sweating and running around in dirt, you should shower.
Also,
please.
What's interesting is that a lot of people are like, oh, when I start smelling, then I need to shower.
Yeah.
But you're the last person to smell if you
Yeah.
stink. Like someone else can smell it
Yeah.
before you can. So
And that's awkward.
that is awkward.
Anyway, next question.
Okay, not a question, but perhaps some awareness about the HPV vaccine.
Okay.
Vaccine is a scandalous word.
Truly. So HPV stands for the human papillomavirus. And the vaccine is basically to prevent infection by the human papillomavirus.
Yes.
And the HPV is a sexually transmitted infection. And that's how you get HPV. And there are 2 types of HPV, I think, that can cause cancer.
Oh, yes.
Yeah.
2 types, but they're like 100 different
There's
types.
so many types, but I think
Yeah.
it's, if I wrote these down correctly, it is type 16 and 18, which can cause cervical cancer.
That is correct.
So that's why a lot of doctors recommend that women get the HPV vaccine, especially if they're going to be sexually active.
Yes.
You can start, like children, boys and girls can get it, by the way. Like it's not just a thing for girls.
Yeah.
They can be given it as early as 9.
Wow.
Yeah. But they say it is best to do it before sexual contact, and it is given in 2 injections. And I think it's not common for it to be given like past the age of 25, something like that.
I actually don't even know. I just know it's important when you become sexually active. And a lot of people, like, I think they have reservations, like they have reservations with every vaccine. I think the difference with this vaccine I was reading is it's not injecting like a very small dose of the actual virus. It's just the outer particles of the virus, which apparently teach your cells to become immune to it. So
that's almost similar to like the mRNA kind of vibes where they teach. Okay.
So
we're not doctors.
No, but I think I don't know. I haven't heard that some people are skeptical about anything when it comes to reproduction, but I don't think that there are many.
Yeah, I have never had the HPV vaccine, but I've also not been.
We are virgins.
Yeah, I've also not been sexually active with a bunch of people, so or like one person.
Yeah, they say though, like you're more at risk if you are a smoker, if you've had multiple kids, or if you've been on long-term birth control. I did not research why.
Yeah, so you go and do your own research, people.
We advocate for.
And by say do your own research, I mean go and read like articles, like legit articles, not watch some random YouTube video. Okay.
Okay, your turn to, or was that?
You can go, or I can go.
Okay. Is there a biblical perspective on contraception, or is that just legalism?
Ew. Okay.
Ew.
So do you want to speak about this, considering you're a pastor?
Yes. So I think let's touch, before we talk about like people who just don't believe preventing pregnancy is right, should we quickly, very, very briefly touch on the idea that the birth control pill is a form of abortion?
Okay, so this is kind of a difficult topic.
Yes.
So the birth control pill, the way it acts, I wrote it down. So the way it acts, it basically stops or reduces ovulation in women. And it does this by thickening the cervical mucus to keep sperm from entering the uterus. And it also thins the lining of the uterus or something like that, so that the fertilized egg is unlikely to attach. And I think this is what people are concerned about.
So they're like, okay, wait, explain.
So it's very difficult for a sperm, first of all, to reach the egg, and also for the egg to come down to like meet the sperm. But the thing is that so a lot of people believe that life begins at fertilization, and that is up for discussion. Please don't come for me. This is my belief. I personally believe that it's more likely that life is like properly occurs from the time of implantation.
Yes.
That's just my opinion. So if people believe that life begins at fertilization, then the birth control pill can be seen as a way of ending life because it prevents attachment to the uterus lining and all that.
Yeah.
And that is what is needed for the baby to grow. But for me, I'm thinking like, okay, the baby can't grow if it's not attached in the first place, because then an ectopic pregnancy is considered a life as well.
Considered an ectopic pregnancy a miscarriage.
Yeah.
I think a miscarriage is when an implanted egg, you miscarriage that way.
Yeah, and the
you
thing,
miscarriage that way.
Can I just, before I forget, like, the thing is, like, I'm not an expert on this at all. I don't know if, you know, once the egg is implanted and fertilized, all that kind of stuff, like once you have an embryo, I don't know if the birth control can flush that out. To my knowledge, it doesn't, because you can still fall pregnant when you're on the birth control pill.
Yes.
I'm not entirely sure. So if you're concerned, like, I highly recommend just speaking to a doctor or reading actual articles. The thing is, like, everything that I come across about the birth control pill being an abortion pill, so to say, it's all written by like religious organizations, and it's very opinionated.
It's not like medical.
It's not medical. And you can believe that there's this whole conspiracy to like abort children, but I don't necessarily think that's the case.
No, but if you have that conviction,
then don't use it. Simple as that.
Something though is you do get mixed pills and then pills. So you get pills where it's just progesterone, and that's what most people are on. And then you get, I think it's a combined pill where it's estrogen and progesterone. And when you are taking an extra estrogen, it prevents you from even
ovulating
at all. So if you're like very worried but you want to be on a pill, it's a bit heavier and side effects are worse, but go on a combined pill, because then you won't even have eggs. So the uterus is thicker and you won't ovulate. So
I mean, a lot of people are very skeptical of the pill. So if you have that conviction that it is wrong to use the pill, then don't use it. I'm not going to say, no, you have to use the birth control pill, because there's a lot of reasons not to use it, even apart from that. But once again, there are a lot of reasons to use it as well. So there we are.
Cool.
I feel like that was maybe a bit controversial.
Yes.
Please don't attack me.
Also, one thing can I just say about the pill is... So I've been on so many pills, all of which made me terrible, except Zoli, not sponsored at all.
Not sponsored by Big Pharma.
I can't be on it because of the fact that I'm crazy. But I say that with jest, because I'm fabulous, and if you have a mental illness, you are fabulous too. Yes, that is my simple request. So actually, really, because Zoli is a very light pill, a lot of young girls take it, and it's a little bit more similar to your natural hormones. Can't explain it, but if you want to go on a pill, guys, this is just me personally, because I've been on Zoli and it was amazing with my period, just not great with my mental health because of the fact that I'm bipolar.
And because you're on medication.
Exactly. But I just wanted to say that because I feel like I'm trying to help you out. So like Zoli was just wonderful to me. It was a great experience.
I'm so happy for you.
And everything else, birth control patches made me throw up. Other pills made me so nauseous or so hungry. It was just absolutely so sad.
So when it comes to a biblical perspective, the Bible doesn't speak about birth control really.
No.
So the reason why a lot of Christians, like including Catholics obviously, are against it is because, first of all, they believe that children are a gift from God, and they are. Children are a gift from God, and that we as Christians are called to procreate and be fruitful and multiply. And also there's this idea that if you're using birth control or any kind of contraceptive, that you aren't trusting God with having children. So that's why people feel like that. What do you think, Zara?
So we did actually speak a little bit about this in our episode about sex in season 1. But yes, it's basically this idea of like you are trying to take control of your life. But I don't think it's a coincidence that there is not a single method of contraception that is 100% effective. So I've always said, if God wants you to have a baby,
a pill won't stop him.
You best believe you'll have a baby. There have been people who've fallen pregnant on the pill, people who've, like, the condom is broken and they didn't even realize.
Hectic.
So if God wants you to have a child, you will have a child. And I actually think that God has given us wisdom. And so I think it's actually wise sometimes to be careful about that. You know, if you can't financially support 20 kids.
Imagine having 20 kids.
Like, that's a no. And also, like, it's not like you should abstain from sex during your marriage and only have sex when you want to have a baby. And also, you don't just fall pregnant by having sex. There are people that are not on contraception because of this conviction, and they can't fall pregnant until like 5 years in. And then that's God's plan being worked out. So I just personally, and the part in the Bible where I think a lot of people get it from is...
It's like that Old Testament verse.
Yes, where the guy like
pulls out.
And he pulls out and spills his sperm.
But if you actually read the whole context, it's not about that at all.
Yeah, he was disobeying the law and not doing what he was supposed to, which was to impregnate.
Because if that is a sin, then the pull-out method is the worst thing in the whole world
as well. So it wasn't the actual pulling out; it was his intention.
Yes. I think ultimately God is in control.
Yes.
And I think while children are a gift, I also think medication and birth control can be a gift as well. Not for everyone. For some people, birth control affects them terribly.
Yes.
And the thing is, what a lot of people don't realize is that pregnancy and birth can be detrimental for a lot of women.
Yeah.
It is not, it is a very natural thing to go through. A lot of women do it just fine.
Yes.
But a lot of women can die or have a terrible time. So I completely understand why they wouldn't want to fall pregnant. And then I just wanted to quickly touch on a few reasons why you can get pregnant on the pill.
Yes.
So if you aren't consistent with you're using the pill,
which is scary, hey?
You have to be very consistent. You have to take it
at the same time
every day. And there's even placebo pills, which you don't actually have to take, but they do recommend just so you stay in the routine.
Yes.
So if you all of a sudden don't take the pill, it can often cause you to ovulate because of the sudden drop or rise of hormones, whatever the case is. Also, if you consume a lot of alcohol, apparently that can play a role in your birth control being ineffective, and certain medications make your birth control ineffective. So please check that if you're on birth control and you don't want to get pregnant, if you're on certain medication, it can make it ineffective.
Yes, which is why you should talk to your doctors, because sometimes your doctors don't talk to each other. So your GP doesn't talk to your psych, doesn't talk to your gynae.
Amen.
So yes, I would just like to take a pause to say that there were technical issues with the video. So we're sorry. If you're watching on YouTube, you'll see a bit of video and then no video and then some more video. Just enjoy. And also, this is a very long episode. So
for good reason.
For good reason. So if you are listening on Spotify or whatever, first of all, rate us 5 stars. And then also, if you don't want to listen to every aspect of this episode,
you can go on YouTube.
There are time stamps, so it'll say when we talk about PCOS, when we talk about tampons or whatever. So you can check that out there. And we do that for a lot of episodes, by the way.
Yeah, not all of them though, because that's a mission.
Yes. Okay, whose turn is it to read a question?
I'll just read. So this person just wants us to speak a little bit about PCOS and endometriosis.
Yes.
Okay, so PCOS stands for polycystic ovarian syndrome, or some people say polycystic ovary something else, but it's the same thing. Okay. And so basically PCOS actually affects 1 in 10 women of childbearing age, so it's a lot of people.
Yeah.
It is basically caused by an imbalance in your hormones. It is a hormonal thing.
Yes.
And basically what happens is, sorry, my mic might be a bit loud. A lot of women get enlarged ovaries with small cysts on the outer edges.
Yes.
And there can be really horrible symptoms like very abnormal periods.
Yes.
Or very heavy or very light or things like that.
And it's a hormonal thing, but both of these illnesses affect your reproductive system, your endocrine system.
Exactly.
It
affects
everything. Your
everything.
hair, your skin, your mental health. Yeah. So it's important that it's diagnosed and you get yourself
And PCOS can also lead to a lot of weight issues.
Yeah.
And another thing is, for some women, it can cause infertility. So very tough.
Yes.
And this is something that has to be medically diagnosed. It's not something you can just give yourself.
Had decided. Yes.
And a lot of people use birth control pills to regulate their periods and all that kind of stuff.
And the thing is, it can also hide it.
It can hide it.
So what's interesting is Rebecca Lindenbach from the Bare Marriage podcast, which we love, even though we're not married.
You should listen.
Yes. So she had terrible period pains, she would throw up. Her period was so heavy, and they always just said, "Oh no, it's fine." They sent her for MRIs, and it was just we couldn't, or they didn't send her for MRIs. I can't remember, but anyways, so they were just no, it's this, it's that. And then only when she was pregnant with her first child, she went to the gynae. They found cysts on her ovaries. Ew. And it's had they known that years ago, because since she got her period, she struggled with it.
Oh, shame.
So it's just important, again, advocating and saying, this is not right.
Yeah,
please
this pain is not normal.
Yeah.
Okay, then endometriosis.
Yes.
So this is a disorder where tissue that normally lines the uterus grows outside of the uterus. So basically tissue can be found on the ovaries, the fallopian tubes, and even the intestines. So that's pretty rough.
Yes.
This happens, I think, I don't know if that's right. I wrote here 10% of reproductive age women have it, which is still quite a lot. I don't know.
That is a lot. I also think, this is going to sound not
like
so
it's basically the same amounts of women who have PCOS, I guess.
And I think what the difference is, when you have cervical cancer, it's more difficult for you to figure out, because for a long time cancer is painless, whereas with these, they come with symptoms.
They do come with symptoms.
Like if your body's telling you something, please listen to it.
So some of the symptoms with endometriosis include pain in your lower abdomen, your lower back, your pelvis, your rectum, and your vagina. Also can be characterized by abnormal, very heavy menstruation, or just like weird things happening over there. And it can also cause infertility, unfortunately.
Yes.
Yeah.
So that's why you should be seeing your gynae.
You should be seeing your gynae.
Okay, should I ask the last question?
Yes,
the
best
is
one.
Hilarious.
Okay.
Is putting a tampon in ever pleasurable?
Okay, no. The answer is no.
The answer is
I used tampons for quite a number of years. Never once did I get any pleasure from it. Because first of all, you're on your period.
Yeah.
Not that pleasant.
No.
Second of all, a tampon is too small to do anything.
Yes.
Third of all, most women don't get pleasure from penetration.
So that's how I was going to say, like, in the same way, like, I think if a guy inserts his penis into your vagina immediately,
that's
not pleasurable.
Pleasant. Yeah.
So there has to be a lot of other fun things. I probably know more about sex than I should. Not than I should.
I don't think so.
But then the normal person would be who has not had sex.
Yeah.
But sex shouldn't be painful.
It shouldn't be painful.
So that's just something to put out there. If sex is painful, it's not normal. Maybe like right off the bat, but it shouldn't.
Yeah.
And like this is a great time to speak about the fact that vaginismus is a thing.
It is, and it's
why
horrible.
did no one know about this?
Yeah.
So there are pelvic floor physiotherapists. So if sex is painful or there's something going on down there where
it's always painful.
If you're inserting a tampon and that's painful, that's not
normal. Not right.
And chances are your pelvic floor needs to be stretched a little bit and adjusted.
Yeah. And even like the vagina, like the vaginal walls can stretch out so much.
I mean,
and go back to normal.
Baby is
it's
going
amazing.
Out there and then you go back to normal after.
Yeah. So if anyone ever shames anyone for having like not a tight vagina, they need to grow up and understand how a woman's anatomy works. Cool. And if it's too tight, then you're doing something wrong, my dude. Okay, there we are.
Yes.
Okay. We hope you've enjoyed. We hope it didn't make you feel too uncomfortable. Please don't shout at us in the comments because that's rude. You can tell us your opinions though in a respectful manner, and we will respectfully engage back.
Yes. Again, not doctors, virgins, women though.
Yes. So we did try to do research. We can probably make this kind of a series because I think a lot of people have these kinds of questions.
Could even do like general health more.
Yeah,
like lots of things.
Totally, bro.
Yes.
Okay.
I would like to say, guys, that if you enjoyed this episode and you're a good person, remember that sharing is caring.
Amen.
In other words, share this with everyone you've ever met.
You'd better.
Yeah. Guys, like a lot of people, I think, just never click the like button or never rate the podcast or never. And it's a mission.
Yeah.
But
it helps us to get out there.
That's how we show up on people's like timelines and stuff.
Amen.
So, and I promise we're not trying to make money out of this or anything.
We get nothing. No. Genuinely. We've spent more money than getting money.
Yeah. We've got no money from this. But yes. This was great. I got to see Danielle in person and that is a good time.
Okay.
Bye.
Bye.